We're getting some texts in on 2442, and one of the questions that come in is, what is the process of someone who comes to report gender violence to the Gender Violence and Recovery Center? What is their process, and more importantly, what is the recourse? Please be sending in your comments to 2442.
The process is easy in that we have documented the steps that somebody goes through, but just to outline it, one is that we integrated the system into the rest of the hospital system. So that removes the stigma. If you set up a center that only deals with gender-based violence, people are going to shun it. And we've done some experimenting, like opening one in Kibera, and find that the people will bypass it and come all the way to the hospital. Why? Because the villagers and the other people will be pointing at, oh, look at what happened to Samantha, what happened to Dr. Tenya. They must have been either sexually abused or beaten by their spouses for them to go to that unit. But incorporating it into the mainstream hospital, then that has removed the stigma. So they walk in, we're able to pick in depending on the complaint, and then we take them through the medical examinations, of course, after taking their history. We provide all the laboratory testing. Then we give them the treatment, the medication. If they need admission, we admit them. If they need any surgery, we do the surgery. And all this absolutely free.
Absolutely.
Yeah.
What about the recourse when it comes now going to the police station? What does the legislation say about gender-based violence as well? Once I'm hit and there's cases where we've both seen where limbs are chopped off by husbands, and then once those wounds are treated, how are we going to now deal with the perpetrator of domestic violence?
Okay. What we do is that we encourage all the survivors to report the police station. They usually get a P3 form. Mm-hmm. I've seen the police change. Since 10 years ago to now, there has been a huge paradigm shift in the police force or police service now. And you must commend them. We've also been actively involved in training them, and many other civil society organizations have also been training them. And I know they have really embraced the issue of gender studies in their curriculum. Mm-hmm. So commendation to them. In fact, a lot of the survivors are also brought in by police. When you report the police station, yeah, you'll hardly go a day without seeing a police car bringing a survivor to Nairobi Women's Hospital. Wow. So what happens then after that is the process of the criminal justice system taking over. Unfortunately, it has been a very tedious process. Just to show you an example, first of all, let me go to the process. Of course, then the prosecution, investigation.
Absolutely.
And we really do support the police. We give expert witness. But just to give you an example, about a month ago or so, I was called to Makandara law courts to give evidence in a case that I attended to in the year 2004.
Wow.
So where is the process of justice making? If a case where a child has been defiled, 9-year-old girl, defiled in the year 2004, now we are talking about 7 years later is when the case is being heard in court. I mean, it's totally ridiculous.
It's just not right, actually.
It's just not right.
Yeah.
So I'm hoping that with the new dispensation in the judiciary, that this is going to be a thing of the past. I hope the new Chief Justice is watching this, because honestly, it's been a big struggle. The second thing is that when you look at the number of convictions that come through from the judiciary, it's been pretty low. Partly, again, maybe not to blame the judiciary, the investigations that have been carried out and corruption in the police force sometimes, that a lot of cases get lost through. But finally, even when those that get convicted, you find a magistrate in this day and age, yes, concluding there was rape or there was defilement, and not prescribing the minimum sentence that has been prescribed in the Sexual Offences Act. So you ask yourself, is it that they don't know about the act, or which other law are they using? So these are the challenges that are faced subsequently. So
what are we doing about those challenges? I mean, if you look about it in a more broad perspective, the judiciary has always been very slow, and it's something that they've constantly being told that they need to speed up on. So what are we going to do, especially when it comes to gender-based violence, which, I mean, is such a broad category. Like you said, defilement of children, 7 years later, there's still no justice. What are you doing as the Gender Violence and Recovery Center to make sure that whole process is a lot faster?
What we've done is to hold workshops for them. I am also privileged to sit in the Sexual Offences Act Implementation Task Force. So we've had some workshops to try and enlighten them and have them pay attention to gender issues, and especially on sexual offences. I must admit sometimes the attendance is not that good unless you take the workshop to Mombasa. we don't have that kind of money sometimes, of course, most of the time actually. So, and I don't think, I think we need to go into a new Kenyan dispensation where, look, it is not the responsibility of the Gender Violence Recovery Center per se. Yes, we've taken this upon ourselves, we are going to do it, we are passionate about it. But I think it is faulty for a judiciary that's funded by the public, and by the way, we don't get any funding from the public, for it to wait for us to organize for a workshop for them to understand a law that is supposed to be implemented using the public funds. So it's a question of every institution taking responsibility of its mandate and working in tandem with all of us, then we can be able to achieve a bigger and more prosperous Kenya. Otherwise, if it is left to what is GVRC doing, and I get that a lot of that when we go to meetings. Oh, you know, you are just in Nairobi. What are you doing there? We have so many problems here in Mombasa. We have so many problems here in Meru. We have so many problems here in Homa Bay. What are you doing just in Nairobi? And I'm thinking, my God, I wish I could be everywhere, but I don't have the resources. It's also to recognize, and let me say this without any fear of contradiction, that this is a public health issue.
Absolutely. Absolutely.
And until we actually mainstream it into the public health policy, national policy, then we'll always continue to struggle with it.
Okay. We have a lot of interesting questions coming in on 2442. One of them says, I'm a lady of 26 years. I've been married for 3 years without any issues. I fought with my husband recently and injured his manhood. He promised to forgive me. What can I do? And another question, just to touch on that as well, is why are they so reluctant to deal with cases of gender violence towards men? I think that all comes around the stigma about men. I mean, I can drive to work every day and there's a radio station laughing at a man who went and reported it. What are we doing towards the stigma with men? And is it true that you're actually reluctant to deal with such cases?
Okay, I must say that we are not reluctant to deal with the male issues. In fact, we've been advising men to come out, and in the recent past, we've had men coming out. If you look at our data currently, initially we had no men for the first, I think, 3-4 years who came out. But we did a lot of aggressive campaign that, yes, it also affects men. I'm a man myself. So I felt, you know, look, yes, gender violence is not about women. We need to make it a societal issue. So we took a very clear stand and moved it to the mainstream, that yes, it affects men. And currently, I must admit that about 4% of the people who walk through our doors are men. So we are not reluctant. In fact, we are more than willing to deal with issues where men have also been affected. On the issue where somebody has injured the husband, it's good if they are willing to reconcile, but what they need to do also is to go for counseling. First of all, he also needs treatment.
Absolutely.
And again, we can be able to offer that treatment free of charge. And subsequently, they would have to go for family therapy. It is important that the perpetrator recognizes that they have done something wrong, and then they also go for they come for psychosocial support as well.
Absolutely. In fact, there's a lot of questions coming in about payment. There's a lady who said do you get treatments for STDs? Is it free? There's another lady who said, what about counseling for the psychologically tortured and at what cost? And I think one of the things is that you are a free, free
Yes.
organization.
We offer free services for all forms of gender-based violence. I think that needs to be very clear.
Absolutely.
Yes.
Okay. Okay. We have another a question here. My sister is a victim of violence due to a girl child that she brought into the relationship. What can she do? Does she call it quits because her husband really doesn't care? And one of the things I'm noticing about all these SMSs that are coming in is that it's always a third party who notices the problem. It's not the perpetrator and the victim themselves. So what can she do? And also, what can the third party do to make sure that these things don't happen again?
Okay, I really hope that is the setup, because what happens a lot of times is that when I have a problem, I usually would then say, my brother has a problem. Yes, most of the time we find that. But nevertheless, it is good when they're asking third party, because then they feel that they're shielding themselves. But it's also good to face the reality and not use third party and say, look, I am having this problem. That's the only way you can get help. So by having said that, third parties also have a big role to play. In one, they can encourage the people who are concerned to seek help. But number two, where a crime is being committed, they can also report the crime. Now, in the issue where you are in an abusive relationship, one of the problems, as you said, yes, are children brought in from a different relationship. Then one would wonder whether there was discussion about it before, or was this a surprise sprung in? And now that you're in it, is a question of either finding a solution to it, or saying, look, this is not working, then how do we amicably sort it out?
Absolutely.
Whereas we don't encourage marriages to break. Absolutely not. We do not encourage marriages to break. So let me make that clear. On the other hand, you don't want to stay in an abusive relationship and end up dead. We've had situations whereby not only actually the survivor or the victim could die from injuries, but you find where people who are on defense actually cause more abuse and more harm and even death to the perpetrator. And you see then they're also charged in for murder.
Absolutely.
So it's a cycle that really, we really would want to intervene before we can get to where people are injuring each other.
Wow. Okay, a lot of SMSs coming in, so I'm just going to try and go through a lot of them. I'm Abdi Nasir from Lodwa. I'm asking this, for those of us who are living on reserves or even basically out of Nairobi, what is the solution to gender-based violence and what is the GVRC doing? I know there's a lot of community-based programs, so let's just talk a bit about that.
Yeah, we have a lot of community-based programs. We are working in Northeastern. I'm actually going to Garissa this weekend, and I'll be there in the whole of next week. We have programs there. We are unable to reach the entire country at the moment. We have an ambitious plan to at least cover the next, in the next couple of years, all the 47 counties. We just expanded to our new 3rd unit in Ongata Rongai. So I just ask Kenyans to be patient. We have limited resources. As I said, we don't get any public funding. If we had the public funding, especially the money that's being stolen, we could easily reach all the counties in the next couple of years. But now that we don't have, I would say that the first thing is, one, seek help in the nearest public hospital. We've trained a lot of healthcare workers. Actually, it should be your right to get treatment in a public hospital. Subsequently, if they don't get the psychosocial support or they don't get medication, they could easily travel to any of our gender violence recovery centers, the one in Hurlingham. We have a branch at Adams and the new one in Ongata Rongai.
Absolutely.
But that's all we can offer for now. But we are looking at a couple of others outside Nairobi as well. And as we go along, we shall tell the public where we can be able to help.
Okay.
But I need the public to understand that we're only just trying to help.
Absolutely.
And we operate on the goodwill of our donors and, of course, the public that supports us.
Okay.